name is Robert Fontanelli. I'm a snowbird. I had known other people that had strokes, and I thought I was having signs of strokes.
The ambulance brought us to Delray Center. He was having a stroke. They came in and they took him and said they were coming to Delray.
5 guys walked in the door. I couldn't believe. He says, "Who am I, the Pope?" I was eternally grateful that I came here because they said, "You have a choice." I said, "No, you take me to the trauma center. Why would I go anyplace else?" They had TCAR surgery performed by Dr. Ricotta, and I feel great.
So Mr. Fontanelli is a very nice gentleman who had about a 95% blockage of his carotid artery. The risk of stroke was very high if we didn't do anything to treat it. At Delray Medical Center, we're one of 30 or so centers of excellence in the world that performs what we call TCAR, transcarotid artery revascularization. The advantage of TCAR over the traditional treatment, which is carotid endarterectomy, is that it provides better outcomes than carotid endarterectomy. The risk of stroke with carotid endarterectomy at 30 days is about 2%. With TCAR, it's less than 1%. And we found the results have been outstanding. The patients have quick surgeries, quick recovery times, and they're back to their normal life in 1 to 2 days. Vascular disease is not a disease that can usually wait. If you delay the care, the problem becomes more complicated, more complex. The fix is more complicated and more complex. Usually that results in a much longer hospital stay and worse outcomes.
I had no reservations at all about coming in here, COVID, because all the precautions are being taken. You'll be safe here, believe me.
You're more likely to get the virus at the grocery store than you are in the hospital. So if you're out shopping for lettuce and tomatoes, you can come to the hospital and have medical care. The COVID patients are separated from the non-COVID patients, and basically they've created a very safe environment, not only for the patients, but also for the medical staff as well.
If we had gone home to New Jersey, we would fly back to come to Dr. Ricotta because there isn't anybody else that we would rather have.
I don't know if the people in South County realize what they have here, but this place is one of the best hospitals in the country, as far as I'm concerned. The results were what I expected. I didn't think there was an iota chance of anything being not the way it was supposed to be. I would extol the virtues of the staff, everybody. I'm very grateful for all the people that work at Delray Medical Center.